the 2011 Fine Award for Teamwork Excellence. Gold winner for Sustained Improvement. St. Clair Hospital. Sustaining excellence in patient flow in the emergency department.
Prior to our changes, our process improvement changes, it could take upwards of 80 minutes before a patient would even see a physician. A patient would arrive at the front door of the emergency department. Then they would typically have a seat in the waiting room. They would fill out a piece of paper with their name and some basic identifications and a reason why they were here. Then they would have a seat in the waiting room. They would then call the patient back to a triage room. At that point, they would get a full nursing assessment done. And once that paperwork was completed, they were typically asked to have a seat back in the waiting room. The patient would then be asked to go to the registrar, and their office was down the hall away. They would complete a registration process and be asked to have a seat in the waiting room again. Their paperwork would then go back to the back. It would be put into a queue, and that patient would then be waiting in the waiting room until they were called to the back. And then the charge nurse would take them back and put them in the room. They waited for the physician to come to the room.
It's nice to meet you. Sorry you're not feeling so good.
Now when a patient arrives, they approach the intake nurse. At that point, the intake nurse identifies the patient. An armband is generated immediately, simultaneously while getting the patient's weight, which is something we put into the system immediately so that if we have to give a critical medication, we've got an accurate weight. It's very important for patient safety.
Chris is going to take you back. New patient to room 31. New patient to room 31.
Kirk available.
At that point, the patient is taken directly to a treatment room in the back. The nurse will mark that they're in the process of doing a triage assessment. The nurse then changes the status of the patient to provider to see status, which gives a blue flag indicator to our physician staff that they now have a patient that's ready to be seen. The physician then will use that same status board and change the status of the patient from provider to see, which was the blue flag, to treatment in progress. We knew that we had a sound system, so the challenges, the opportunities we saw, what we needed to do to sustain that were a couple. The Toyota production system is our foundation for process improvement. As such, the organization is committed that every employee will be trained in those principles. Once we worked out the facility issues, the technology issues, the process issues, we felt we wanted to add another component which dealt with the communication or the customer's experience piece of it. We chose the Studer model of ADET as our framework. A stands for acknowledge, which is acknowledge the patient and greet them. I is an introduction, and it teaches you how you can introduce yourself to help reduce that anxiety. D stands for duration, but also under D we talk about delays. Explanation is simply explaining what you're going to do, why you're going to do it, and what the plan is. And T is a simple thank you. We've been using our new process over 3 years now. We're averaging about 145 to 148 patients per day. We're now averaging upwards of 176 patients per day. Our door-to-room time was 54 minutes. Our average for the entire fiscal year 2011 was 4 minutes. Our door-to-provider time dropped from 81 minutes prior to our changes to 22 minutes on average. We actually achieved at one point the highest raw score for 50,000 EDs visit or above in the United States at one point during the past couple of years. Without those changes, without that hardwired system that everybody understands, sustaining would be significantly more difficult.